My name is Dr. Patrick McGrath, and I am the head of clinical services for NoCD. Very good to have you all here tonight. And just so you know, NoCD, free downloadable app available to you. And it is on Google and iOS. And you may also go to treatmyocd.com if you have an interest in looking at our teletherapy service that we have available. We are currently in 24 states. If you're a therapist and you're interested in joining NoCD, please reach out to us. We are recruiting. And we are continuously working on getting more and more people with NoCD covered by insurance, just so you know. Carl asks if this is a fresh haircut. It is, Carl. Thank you very much for noticing. I was getting a lot of drag with all the hair. I couldn't run as fast, so I had to get more aerodynamic, and this was much more important. Now, before I get in, it's just me tonight, so we're going to go back to our Q&A style that we did for a while, but we're going to have more guests come at times too. I thought some of our guests were just amazing. I mean, that was such a great first Diversity Matters webinar that we had. And it was so fun to have Dr. Pollard on last week, my first OCD supervisor, 20 plus years ago, because I'm old. So that was really fun, and thank you all for joining in on those and asking the questions that you did. And Dr. Storch, who talked about working with children as well. So it was what a privilege for all of those things. I have a cool job. Get to do some of that. I'm going to get a little personal to start off with. It's been a heck of a week, I got to tell you. Many of you know my wife has a pretty significant cancer, so she was having a lot of issues this week. And we were at the doctor and scans and all sorts of things. So it started me thinking today, just, how easy it would be to kind of go down the rabbit hole of just being sad and depressed and angry and all sorts of things. And so I spent about 10 minutes or so before getting on here watching videos of people being kind to each other. And it was just such a lovely pick-me-up, actually. I have found those pick-me-ups are needed, even for us therapists. We need that as well too. And it got me thinking, though. I was coming to sit down over here. I had my computer over there at the other side of the basement, was doing some work. I was coming to my little realm, my rush realm, as I like to call it. And I thought, and I actually made a poll. I've never used the poll aspect of this, but if any of you notice that there's a red dot over poll, at least what I see poll over here in the up and down areas, maybe you see it somewhere different. I have to look, but there is a poll there. So, and the poll is this: would any of you treat someone that you love the way your OCD treats you? I want you to think about that for a minute. I'm going to bet, Allison's already jumped in. Heck no, never. Micah, never. Okay, good. So I'll even tweak that a little bit. Would any of you stand for anyone else treating a loved one of yours the way your OCD treats you. So like you were in a room with a loved one and someone else walked in and started just berating the crap out of them and telling them all sorts of things they might have done wrong and started putting all sorts of thoughts into their head and stuff. Would you stand for that, or would you just say, well, that's true. It could be. You're you know what? You're right. That's very relevant. That was actually great to bring up there. I think they needed a dose of that reality, and nice job. I'm so happy that you've brought all those things up for them to now be worried about. I'm getting a lot of no's and nevers going on. Okay. So that leads into one of my favorite topics that I do in one of my talks that I call specialness, which is OCD makes you believe that the rules of the world apply to you differently than they do to anyone else. And Carolyn, I agree with you. Your OCD voice is trying hard to protect you. It's just doing it in the absolutely most awful, horribly wrong way. But Carolyn, if I don't get back to that, remind me again, because you're on to something there, and I want to come back to that. But let me finish specialness first, and then. But Carolyn, like I said, just be my reminder, okay? Specialness to me, there are two things with specialness. So I'm going to give all of you a homework assignment tonight. Okay? For the next 24 hours, so until 7:07 p.m. tomorrow night, I want you to treat everybody you know like you normally treat yourself. Okay? And then see at the end of 24 hours if you have any friends whatsoever. So maybe don't actually do that because I think no one would ever want to speak to you ever again for the rest of your life. So why don't we do the opposite? I want you, thank you, Carolyn, I like that. I want you for the next 24 hours to treat yourselves as if you were your very best friend in the entire world. Okay? Anytime you do anything well, I want you to say to yourself, yeah, nice job. All right. And anytime that anything goes wrong, I want you to say to yourself, yeah, whatever. And I just want you to try that. Just literally 24 hours. That's it. And I want you to see how that feels. Okay? Because I'm going to bet you don't really know what it's like to be nice to yourself. I'm going to bet also that even if you do try to be nice to yourself, your OCD says, well, that was dumb. Why would you ever do that? I mean, you have to be reminded of all the dumb things you've ever done. If you don't, well, then, you might make mistakes. Okay. So it's a challenge. I understand. But I want you to try it. Because we already know that if you did treat everybody else the way that your OCD treats you, or that way that you treat yourself, right? No one would. Nicole just gave a great answer. I'm going to positive reinforce the blank out of myself. I like that. Very good. Thank you, Michelle. But it's interesting, and this goes back to what Carolyn said. So thank you again, Carolyn, for bringing that up. OCD is a liar, and here's the lie. OCD says to you, I am your friend. I am here to help you. And here is how I am going to help you. I'm going to help you by reminding you of every stupid, dumb thing you have ever done. And that is going to keep all of those things at the forefront. And then once it's at the forefront, you'll always be looking out for it. You'll always be on guard for it. And if you're always on the lookout for it and you're always on guard for it, then it won't ever happen because you'll always be on the lookout and on guard for it. So guess what? I, your OCD, am actually here to help you. Now, I may bug the ever-living crap out of you in the attempt to do it, but know, please just know, that if I wasn't here, poop would hit the fan. It'd be just a poop fest. It'd be poop flying everywhere. And if you had contamination issues, that'd be even worse, right? But I, your OCD, am here to help. So guess what? That stupid therapist of yours, don't listen to them. Don't do that at all. They don't know what they're talking about. Because as Carl just said, he said there, it's amazing, Dr. McGrath, you've managed to collect all of us, murderers, pedophiles, HIV/AIDS patients, closeted homosexuals, and blasphemous folks together into one spot. Yes. And in fact, I've used that kind of very example. I've said when I'm running groups of people with OCD, I said, I've either collected the most dangerous group of individuals in the entire world together in one room, or all of you have OCD. It's one or the other. Now, if any of you can point out to me a news headline that said, person with OCD actually goes and does the thing that they've been afraid of all these years, please forward it to me. I would love to read that. I've never read one of those, but if you know of one, please let me know. So none of us are special. We're all unique, but none of us are really special. Specialness just doesn't work or apply in this kind of situation. So Allison named her POCD Brad, and now it says, Brad, leave me alone today. Well, okay, there you go, Allison. I like that. Sal says, that hope idea is so hard to swallow when I'm suffering so much. Sal, please tell me more about that. Please type more about that. I'd like to hear more what you mean by that, because I want to kind of get into this and see what you think. So far, our poll is 100% that none of you would treat anyone you love the way OCD treats you. So, well, that's what it's pretty telling. I think that's wonderful. Okay. Now, let me go back on some questions and then we'll get back to Sal's. I don't know if any of you saw the original quote I put in there. It's from the greatest band in the world, right there. Those three guys, Rush, and me over there, the bobblehead of me trying to join the band. I've always loved this. Some are born to move the world, to live their fantasies, but most of us just dream about the things we'd like to be. And I think, boy, there's some OCD bit in there, right? Where OCD prevents us from moving the world and living our fantasies and leaves us dreaming about the things we'd like to be or we'd like to do. But we don't actually do them because OCD tells us to be afraid of doing them because we might not do them right or anything like that, right? We might get it wrong. We might goof it up. And wouldn't that be awful or horrible? So why should we even try, right? Okay. Well, let's get into some of our Q&A. Always a fun time to be with all of you here and to do some of this. So if you have OCD, how is it recommended that you talk to your children about it? I have a very inquisitive 5-year-old that asks questions and notices everything, and I don't want to pretend like it isn't there, that I behave in a sometimes normal way. Well, Britta, what about bringing your child into a therapy session and kind of explaining that, there are many kinds of doctors, and some doctors help you with things that are going on physically, and some doctors help you with things that are going on mentally as well too, the way you think. And sometimes when you see a parent doing something that is different, there are doctors out there that can help them with that too. And so sometimes I may do some things that seem different than a lot of other people do, but I go to a doctor to coach me to work on stopping those things so that I can learn how to not have to do those things. And I think that might be really helpful. No reason to hide something like that, right? Postpartum OCD. Well, yes, perinatal postpartum OCD, very big deal. We know that hormonal changes affect OCD. So I've had numerous female patients who will say that week before their period is hell. It's just so difficult. Their OCD is just screaming. So we already know, even prior to pregnancy, that there are hormonal concerns that go on with OCD. And then once becoming pregnant, and the hormonal changes that occur with pregnancy are just even more exacerbated, that it's not uncommon for people. Now, you can have all sorts of kinds of OCD thoughts, right? What if I were to harm my child? Men get this too, actually, though. It's actually not just women, so it's not purely hormonal. Okay, just wanted to say that. I have treated males with perinatal OCD. Sometimes their partner is pregnant and they're so worried about doing something wrong while the baby's still in utero, and others where once the baby's there, they're so worried. One dad who got extremely angry at his wife because someone came in the home who was doing some work outside and they'd been using some spray paint, and he was so angry because what if there was spray paint on his shoe and now it's on the floor and now their child's crawling on the floor? And he said, why don't you just spray paint in our child's face? And that's when she said, you need some help. There's a little bit going on here that's beyond what I can do, right? So while this is predominantly female, I just wanted to say males get this, but so not uncommon. And we hear all the time about postpartum depression, but we just don't hear enough about postpartum anxiety and OCD. But boy, it is there, it is real, and it can take on themes that are frightening, like what if I were to harm my child? What if I were to molest my child? All of those types of concerns. I treated someone who didn't touch her child for the first 6 months the child was born. She didn't lift him up. She didn't touch him. She was afraid she would molest him. And what a great day when she came into therapy, and after being with us for a while in our program that I had at Alexian Brothers Behavioral Health in Chicago, which is still going on, that one day she finally picked up her child. And boy, there wasn't a dry eye in the house, I'll tell you, because people were so excited to see that. So as was she too. Let's see. Gwen, could you do your question again? There's a typo in there, and I just don't know what you meant. It's hard to say there for everything. So Allison, my OCD tells me I'm not worth a dime because I've made minor mistakes in my life, and I wouldn't wish this on my worst enemy. Boy, I don't know anyone who hasn't made minor mistakes or major mistakes in their life, including myself. So I'm wondering if, therefore, I'm also not worth a dime for having made mistakes as well, too. Or is this where specialness applies once again? Because Allison, you might say, well, it's fine for everyone else to make mistakes. That's absolutely fine and acceptable. It's just not okay for me, right? And that's when we live like this. It's fine for everyone else to be here, but to be equal to them, I have to be here, right? I can't be like everyone else. That would be failure. That would be awful and horrible, because then it would mean I'm actually worse than everybody else. So to be equal to everybody else, I have to be better than everybody else, because if I'm not better than everybody else, I'm worse than everybody else. And that's OCD, right? It's all or it's nothing. There is no middle ground whatsoever, right? I have to be here or I'm here. If you're not first, you're last, right? And that's just the way that we might look at it. Reminder once again, tonight's webinar brought to you by NoCD. NoCD is a downloadable free app that you can get through iOS or Google Play. And you can link to a free 15-minute call with our care team. Go up in that little corner right over there in the yellow box. You'll see a little blue hyperlink. You can go there. You can go to treatmyocd.com. And like I said, free 15-minute call with our care team. We can link you up with one of our specially trained OCD ERP therapists across the country. We're adding more states, more insurance companies. We're working on it. We're getting it there. We're going to make OCD treatment affordable and hopefully reachable to as much of the population as possible. Kristen says OCD is like a cult leader that you blindly listen to. Yeah. And it's not until people are out of a cult that they start to realize, well, why the heck was I listening to that? I mean, that was ridiculous. But you get so caught up in it that sometimes you don't even notice that you're caught up in it. I remember one time, boy, this was a long time ago, I had a patient who would get out of the shower and stand totally naked, and a relative of his would come into the bathroom with Clorox bleach wipes and would wipe him down, entire body, inside of his mouth, eyes, up his nose, ears, everything. And only then would he leave the bathroom. And he would not leave the bathroom or put any clothes on until that happened. And you might think to yourself, well, geez, who the fuck? And since Carl noticed my hairdo earlier, thank you. You need as he said, you need a fresh cut to fight all that OCD. OCD growth is like hair growth, that you don't notice every day that your hair got a little longer, but after a month or two, you look in the mirror and you go, geez, I need a haircut. And that's how it had happened to that family. There were tiny, tiny little things that got added every day that were no big deal until suddenly the whole thing was a massive deal. And it took a very long time to untangle all of that and get him to not need that anymore in order to come out of the bathroom. Sergey. Dr. Patrick, that's me. Thank you. I saw your broadcast with John and Ethan from the IOCDF on moral scrupulosity. I'm glad you saw those. We're doing part 3, actually, July 9th, I think we're going to be doing it. So stay tuned, everybody. Part 3 of moral scrupulosity. You have moral group and religious group, as well as just right and perfectionism OCD. Well, they all kind of nicely go hand in hand, don't they? Also, you have a deep and much concern about what people would or will think about me in public, how you dress, react, which gestures you use. Often you feel shame that you could not be fitting to what they could be expecting, and that you could be offending anybody on the street just the way you are. So You fight with that almost every day. The feeling of shame and guilt are haunting you. Can I please give some piece of advice? Well, of course. I'd be more than happy to. The first one is, and I say this to my patients, frankly, who gives a crap, right? And I would say the same thing if you had social anxiety about what makes you, and I say this kind of jokingly, so don't take it too seriously, but you get the point. What makes you so important to everybody else would be my question. I mean, why should anyone else give 2 cents about you? And I don't mean that in a mean way, but why are you the most important person walking down the street? Because I got to tell you, I'm far more concerned about myself than I usually am about anybody else walking down the street. I really don't, frankly, give 2 cents about anybody else walking down the street. Unless, I see somebody maybe in distress and I might try to help them or something like that. But otherwise, you're not on my radar. But it's interesting that your OCD tells you that you are on my radar. So I want to point out something. OCD really is crappy to other people, because OCD tells you that other people are thinking these things about you when there's absolutely no evidence of that fact whatsoever. I mean, how does your OCD know what I'm thinking? In fact, we're going to test this out. All right. I'm going to write something down. Okay, hold on. All right. I just wrote something down. Not on that side. I'm not going to show you that side. I have it written on this other side here. So I want all of you to tell me, I want you to type in what you think I wrote down. All right. I have a blank piece of paper here. It is on the other side of that paper. I want all of you to tell me what I wrote down. I'll give you a moment to write it in, and we'll see what you think. Because if your OCD has predictive powers and your OCD knows what people are thinking about you, your OCD knows what people are saying about you, your OCD knows the feelings that everyone has about you, then right now I wrote something down, and your OCD ought to be able to predict it and tell me what it was. So right now we have something about the current weather or animals. Someone says, no one can tell. The current weather, no. Music, no. That would have been obvious. That Rush is the greatest band ever. I don't have to write that. Everybody knows that. I mean, come on. I mean, AG, please. Everybody just knows that. That doesn't even need to be written down. Anyone? No. I did not write that Carl is incredibly talented and smart either. No. Allison, I like yours. OCD is dumb. That is true. But Aaron says you don't know what I'm thinking. No, I didn't do that either. So far, all of your OCDs suck. Just so you know. I mean, we knew that already. Just even before this. Let's just be honest. We knew that already. But none of your OCDs are correct, because what I wrote down is there is an awesome picture above my computer. That's what I wrote down. And there is, hold on, I'll show all of you. Hold on if you want to see it. I actually got this at an OCD Foundation conference. There's the picture. It's a cool graphic design picture. I have no idea exactly what it's from or what it is, or it's probably just an awesome Photoshop of some object that they played around with for hours. But that was for sale at an early OCD Foundation conference when they would do some art stuff and everything. And so I bought that there because I just thought it was way cool. So that's what I wrote down. So Carolyn wrote, my OCD says, I don't care what Patrick wrote. That's awesome. Now, all of your OCDs failed right there, just so you know. None of your OCDs were right. And I could probably do that hundreds of times and none of your OCDs would be right, which basically says to me, the predictive power of all of your OCDs sucks. It's just crap. All right. It's absolutely horrible and awful. And yet, how many of you still say, but there could be this one time that maybe what if, and you kind of go with it, right? Is it worth the time and effort? I wonder. I don't think so. So, all right. Let's go back. Where was I? One moment here. Okay, there we are. All right, I found where we're at. Stacy, first time here. Welcome. You're on quarantine right now, too, like many of us. I'm glad you will be nice to yourself. That's wonderful. Very good. Kristen, I feel like I'm the only one who can protect my family and the people I love. I feel like all the things I do to protect them, and then it stops there, but I'll assume are helpful. Well then, Kristen, I'm curious why any other families are alive, because they don't have you. I mean, with that kind of logic, every other family should be dead by now. So back to specialness. Kristen, I don't mean any offense to you, but there's nothing special about you and what you're doing for your family that's protecting them. That's better than what any other family is doing, even though your OCD tells you that that is the case. Can OCD become a symptom of long-lasting anxiety, or is it the cause of anxiety? Well, in the old diagnostic manual, OCD was an anxiety disorder. Now it's in the OCD and related disorders, but I don't care if they moved it or not. There's still a ton of anxiety with OCD, because the second somebody has an obsession and can't do a compulsion, they start to get really anxious or uncomfortable. So you can see OCD causing a great deal of anxiety. And your OCD might tell you, Aaron, yes, you don't, or you have to do this or that, or you're not doing enough. Yes, well, you can never do enough for OCD, because OCD is very hungry, it's totally insatiable, and you can never feed it enough. So you will always get that answer, Aaron, that you're never doing enough, because that's the way OCD is. I mean, never once in all the years of treating OCD have I met a patient whose OCD said, well, you've finally given me everything I've wanted. Thank you. I'm going to go away now. That's never happened. Allison says, I am the human version of her OCD. Well, thanks. 20 years of treating this, I think I've taken a few tips and cues from it. So, yeah. It would be nice, Kristen, if there was a magic wand, yes. All right, Allison, you asked me to look at this question. I remember weeks ago you said you name your OCD. You feel like your POCD is, Brad, okay. I'll go on for that. I saw that one. Sal says the help idea is so hard to swallow when you're suffering so much. Yes, well, But Sal, then you also have to decide. Let's take it out of OCD for a moment and imagine that you broke your leg. And if you broke your leg and they said, Sal, we've got some painkillers for you, would you say, no, oh gosh, no, I must suffer. Only by suffering will my leg heal. There's no thing you can give me that will help me, even though numerous people take those. And there's no surgery that I can have, even though there's a surgery that's been like rather always successful with this kind of break. You know, they go in, they put a plate in, a few screws, but no, not for me. No, it would never work. It can't help me. Well, that would, Sal, I don't know that you're an old man sounding, when I'm doing that, I don't know why that came out that way, but that would be ridiculous, of course, in that kind of situation. So I don't know why it would be any different for OCD. But OCD always believes it's different and always tells you that it's different because OCD is a big fat liar and wants you to always believe that it is different. So I'm always afraid that I don't have OCD and everything I'm feeling is real. Well, but here's the thing. Even if everything you were feeling was real, but feeling's the wrong word, all right? Let's have a little just moment of education for everyone. Feelings are one word: happy, sad, angry, mad, something like that. There are thoughts, there are images, there are urges. That's what OCD is. It's thoughts, images, and urges, not feelings. Feelings are one word. Okay. So even if your thoughts were real, or the images you have in your head were real, or the urges were real, it still doesn't mean that they actually happen. I mean, in a way, they are real. They occur, right? So I can't say that they're just imagination in the sense of, well, I kind of can. How do I want to phrase this the right way? Even the things, something that you imagine is real in terms of it being a thought, but it doesn't make it a reality. Let's put it that way. This is where we get to that thought-action fusion concept. A thought, an image, or an urge is not an action, okay? So your thoughts, your images, your urges, they're real, but they're not actions. So yes, you have them, right? I couldn't say to you, oh, you don't have that. You're not thinking that. Come on. You would never have that urge. I have urges all the time to hurt people. Every time I drive somewhere and someone cuts me off, I want to get out of the car and beat them. I don't ever do it, right? But I have those urges. So we're not thought police. We're not going to punish people for urges. We get in trouble for actions, right? That's what we get in trouble for. So OCD, though, is thought police, and OCD wants you to be in trouble for images and urges and thoughts because it does believe that they're equal to actions. And that's where OCD is misinformed. It's uneducated. It believes that those things are equal to actions. And because of that, it punishes you because it sees them as just as bad as an action. Sarah wants to know how to stop obsessively thinking about someone. Your OCD makes you think you need to end the relationship. Well, how about this? Stop trying to not think of something. I mean, the rule of opposites, my friend Dave Carbonell, great therapist around here. I should have him on sometime. He's great at taking a look at the fact that therapy for anxiety-based kinds of issues involves doing the opposite of what the anxiety wants you to do. So if the anxiety wants you to run away or stop thinking something, well, the best thing to do is run towards something or purposely think it. And that's actually going to be the most helpful thing. So, Carl is now banned from all of these because he said he's not a fan of Geddy Lee's voice. So Carl, you can't join these anymore. I'm sorry. Sal says OCD just trying to help doesn't make sense to me. Okay, all right, Sal, let me try to explain that a little bit more. OCD says, hey, if you don't go back and check to see if you ran somebody over and that was a bump, you'd be accused for hit and run. So wouldn't it be best just to go back and check just to make sure, so that way you won't be in trouble with the law and you won't go to jail and you won't be on the news? I think it would be a great idea. Why don't you go do it? See how that's trying to help you? It's a lying thing trying to help. It's saying, oh, just in the off chance that that was a body, why don't we just go check just to be sure? I'm just here to help. Not very helpful. A therapist told you, Caroline, you had OCD, but since you believe, oh, you got cut off there, so we'll see if that comes back. McKenna, hi. You've had HOCD for 4 years now, and you're just now about to start proper treatment. Well, wonderful. Congratulations, McKenna. Hopefully that treatment's with NoCD. NoCD, downloadable free app, by the way, on the iOS or PlayStation. And you can go to treatmyocd.com, or you can go over in the corner over there, into that yellow box with the blue hyperlink, and you can go and have a free 15-minute call with our care team and maybe do therapy with someone on my team who will help you with some teletherapy for OCD using exposure and response prevention. Okay. Kristen, as contamination OCD and this pandemic has made your entire nightmare a reality, and you're taking 5 showers a day. Kristen, why the 5 showers a day? I'm wondering. What is that doing for you? Other than alleviating your OCD for a little bit, and then it kind of comes back up, and then you alleviate it again, and then it comes back up, and then you alleviate it again, and it comes back up, and we'll do that 5 times a day, and you're just kind of on a hamster wheel there. Kristen, I'm going to challenge you to only 4 showers tomorrow. And do that for a week, and then 3 showers the next week, and then 2 showers the next week, a day, and then the next week 1 shower a day. And when you're still alive and don't have what you're afraid of, you'll be thankful of all the money you've saved on soap and water, and you'll learn that your OCD was a big fat liar, and taking that many showers a day wasn't actually helping you. It was alleviating the anxiety, but it wasn't doing a darn thing to keeping you safe. That's not the way that it goes. Aaron says, I'm struggling with OCD around recovering from OCD itself. For example, initially, may have the intrusive thought in the shower, you forgot to rinse the soap off, and then you'll rinse. However, this problem quickly shifts over to, okay, now, how do I overcome this? Do I need to leave soap lathered on me for an exposure? Letting myself have the obsession and not do the compulsion isn't enough for you. I need to just be okay leaving soap on after the shower, not leaving it on. Now I have purposely lathered soap on have I lathered it purposely on myself? I can't remember. What do I do? Figuring out how to handle this with therapy is now the OCD cycle itself, and it's becoming really tricky trying to apply a therapeutic approach. I was wondering if you had any advice on how to overcome this. Yes, this is a great treatment interfering behavior, kind of what we were talking about last week, where now I have to do treatment perfectly, right? Because if I don't do treatment perfectly, then am I actually doing good treatment? But since treatment is designed to get you to not do things perfectly, and now you're going to try to do it perfectly, you're actually interfering with your treatment by trying to do an OCD form of treatment. So, Aaron, here's what I want you to do. Take your shower. Get out of the shower. And after you've dried off, take a little dab of soap on your finger, put it on your arm, and walk out of the bathroom. That's what I want you to start with. And then you can go up from there. Okay? See how that works. We'll get to leaving more soap on in the shower and everything like that and not rinsing enough and all those things. We'll get there. But first, let's just do this because we need to interrupt the OCD trying to take over the treatment. Kartik, how can I manage OCD among the pandemic if I can't talk to my parents about it or get professional help? Well, if you're in the US and OCD is available, that is helpful. If not, take a look at either us or the International OCD Foundation has some links for international treaters of OCD as well, too. So check that out, iocdf.org. I'll type that in the comments so that you can see that as another place to go along with treatmyocd.com. Charlotte wants to know how to explain OCD to your teachers. Well, I think that you have to be open to them about the specific type of OCD you have, because your teachers probably think OCD is either checking or hand washing, or putting pencils in the right order, or papers at 90 degrees. And if your OCD is not like that, you're probably going to want to maybe print out an article about it, and or maybe even if they've spliced a lot of these videos from the webinars, maybe you could pick a splice and show them and say, this is kind of what I have and what I'm dealing with, and this is what this guy's talking about, that weird guy up there, and see if maybe that helps to kind of explain it as well, so that you don't have to do it all by yourself. If you are seeing a therapist, you might even get a release and invite your teacher into the therapy session for a few minutes so that your therapist could explain things to them as well, too. I would be more than happy if I was a therapist to do something like that. Okay, Karina, can OCD create false feelings and or give you false ideas about what you want and who you are? For example, sexual thoughts, especially POCD and harm thoughts, can OCD make you believe that you like your thoughts or that you want them to come true? Also, can the same rule apply to urges? Yes, 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 and yes, yes. There you go. Yeah, yes is the answer to every one of those. So I hope that helps. Okay. All right. Can birth control pills make OCD worse? Anything changing hormones could potentially have some effect on that. Yes. Mm-hmm. Oh, Carolyn sent that question back. A therapist who had OCD herself told you she thought that you had OCD, but that since you believe the thoughts, exposure and response prevention therapy would not help. She told me to learn more about God. Have you ever had a similar client, and what helped them? It wasn't going to learn more about God, that's for sure. That's doing a compulsion. So yes, I have had numerous people who were very religious, who were still able to recognize the fact that it was OCD versus religion, right? When you have to be holier than all of the preachers that you see in your faith, or the rabbis, or the pastors, or the priests, or the Pope, or the Dalai Lama themselves, then you've got a problem, right? You're looking, and that's what OCD wants. So kind of think of it like that. Now, I apologize. We've had so many questions tonight. Some things are falling off, so I apologize if I'm actually missing some questions from some people tonight, but we'll be back again. All right. Let's see. Oh, here we go. I think this is the one, Allison, you wanted. You have POCD and 2 kids. Therapy is really helping, really in big letters. So I assume that means really helping. But the thought, what if I was inappropriate with my kids without even realizing, always, also really big letters on that one, gets me because of unknowing, the N being very big in that one. I don't I think he meant ever, want to hurt your kids, but what is if I accidentally did hurt them? This thought is the one that still gets me after weeks of therapy. Okay. Well, OCD loves the unanswerable question, right? What if I did something without knowing I did it? Allison, find me one person in the world that could actually answer that question. Just see if you can find one person who could answer that question. I mean, if in one way that you would be able to get the answer would only be if there were witnesses around, right? But if you were just alone with one of your children and they don't have the cognitive ability to know if you harm them or not, then now what are you doing? You're relying on your own memory, which you can't rely on because OCD interferes with, because OCD tells you, well, even if you remember it that way, it might not have actually been that way. What if it was a different way than you remember it? And maybe you just don't want to really remember it was this way, but it was, and blah, 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 blah. So you're asking the unanswerable, right? But you want 100% reassurance that the unanswerable question can be answered, and that it will be answered in such a way that isn't the way that your OCD fears that it might have been. And Allison, here's the deal. No one can answer that question for me. It's unanswerable. So now, it's not about getting the answer to that question in terms of what you want to do with treatment. It's about, are you okay with having doubt? And guess what? Everyone in the world has doubt about things. But when you have OCD, it tells you doubt about all those other things is fine. Don't care. Whatever. But doubt about this thing, unacceptable. I can't have doubt about this thing. I just can't. It's just not right. How can I live with this for the rest of my life, not knowing if I did something that I don't know that I did? And this is how OCD keeps people stuck. Because it puts you into these unanswerable rabbit holes, but lies to you and says, there is a way to get an answer to this. You just haven't figured it out yet. I'm not going to tell you, by the way to get the answer. You have to figure it out. But it could be answered. I'm just not going to tell you that it really can't be answered, because I just like you trying to figure it out. See what you come up with. So you could spend the rest of your life with your children worrying that you've harmed them, which will make you afraid to be around them or ashamed to be around them, which will be the thing that probably interferes with your relationship more than anything else in the world. Or you could accept the fact that you have OCD, and though you have these thoughts, just enjoy the fact that you get to be around your kids. Okay. All right. You have, Denise, hello. You have harm OCD, and you see an object in a person. The harm OCD thought is the obsession. Yeah. And if you move away from the object, is that the compulsion? I haven't started my ERP therapy yet, but I know I have harm OCD. I'm confused with triggers and thoughts, and what would be the compulsion? If you don't want to use this, you could email me. Oh, no, I will use it right now. Yes, moving away from something is the compulsion. So if I have harm OCD and I'm afraid, what if I were to stab people? I'm going to ask my wife to please hide all of the knives in the house so that none of them are ever around me, so that I don't ever have to sit with them with an urge that might pop into my head that what if I were to pick one of those up and just stab you in the face with it? But if they're not there, then I won't be triggered by them, right? So it's best to move away and avoid if I can. That's what OCD wants. Of course, therapeutically, that's the worst thing you could ever do. But it's sure satisfying and lovely to your OCD. Now, I just want to go to our poll for a moment here. Yeah, we are still 100%. None of you would treat anyone you love the way your OCD treats you. We're going to end that poll. Wonderful. Good. I want to remind everyone that tonight's webinar brought to you by NoCD. NoCD, a downloadable app at Google Play or iOS, and treatmyocd.com is our website. We do have teletherapy. To wrap up, I'm going to go back to what we started with. As I said, it's been a rough week. And it's tough to be a caretaker, which is weird that I say that because it's kind of like my job as a therapist. But I mean it more in the sense of not just the therapy I do with people, but when your spouse has a terminal cancer and you become the cooker and the washer and the cleaner and the launderer and the driver and the putter to bedder and all of the other things. And then you also have to be the taker-carer of yourself. Because if you don't do that, you become really useless to everybody else. And sometimes that's the hardest piece of it all, is the guilt about, I can go out and do things. She can't. And it's a nice day. And it'd be great to golf 9 holes. But should I also stay here and take care of her? And though it's always a tough decision, I try to do something once a week to take care of myself. And that helps rejuvenate me, and I actually take better care of her then, and I can take better care of all of you as well when I do it. And logically, I know that's the way it works. But emotionally, it's one of the hardest things that I do every week, to leave my house and leave her here while I do something for me. And there's guilt, right? I feel guilt knowing that I can do that and she can't, right? So I'm going to go back to what we started with, which is if you don't practice being good to yourself, and you don't allow yourself a break, and you buy everything your OCD tells you is truth, the weight on you is overwhelming. So I'm going to go back to what we started. 24 hours. That's all I want from each of you. I want 24 hours of treating yourself as if you're your very best friend in the entire world. And just see how it feels. And maybe it's a glimpse into what life without OCD could be like. and hopefully the motivation you need to get there. Thanks for being here tonight, everybody. I really enjoyed this. See you next time.